Hi everyone, my name is Roxana Chicas, and I'm an assistant professor at Nell Hodgins Woodruff School of Nursing at Emory University. I'm from El Salvador, and I immigrated to the United States when I was 4 years old. And as a child and adolescent, oftentimes I was the one who would have to translate or interpret for my family or community members, anything that had to do with going to the doctor or anything that came into the mail. And when I would translate for my family or friends at the doctor's office, I realized that there was this barrier of being able to speak to providers, healthcare providers, and that somehow I could bridge that even as a child. Although it was kind of difficult at times to be a teenager and have to translate medical terminology, but I did realize that my language, being bilingual, was something that I could use to bridge that gap and help my community out. When I finished high school, I went off to get a job because I didn't realize that I could go to college or that was even a possibility for me. And so I started working at a pediatrician's office, and there I became kind of the unofficial interpreter because they had Spanish-speaking patients who would come in to see the pediatric nephrologist. And as I was interpreting for patients and learning how to do insurance, I thought, I wanted to learn more about healthcare and medicine and nursing because I felt that sometimes I didn't have the knowledge that I needed to be able to advocate for patients, for all patients. And I thought that I wanted to become a medical assistant. And then one of the pediatricians stopped me in the middle of seeing patients and asked me if it was true that I was thinking about going to school to become a medical assistant. And I said, yes. And he said, why would you do that when you could go to Georgia Perimeter College and become an RN? And I asked him, do you really think that I could be an RN? And he said, yes. And I said, but they're really, really smart. And he said, yes, because they go to school and they study, and you can do the same thing. And so that was one of the first times that I believed him because, I thought, why would he lie to me? he's a doctor, right? So I saw him as this, person who was well educated, and I trusted that he saw something in me. And so I did exactly that. I went to Georgia Perimeter College and applied there to nursing school. And actually, while I was at Georgia Perimeter College, that's when I got introduced to Emory, when researchers from the School of Nursing went to Georgia Perimeter College to talk to us about a program called the Bridges to the Baccalaureate, which was a partnership between the School of Nursing at Emory and Georgia Perimeter College, where they were looking for students who were from minority backgrounds, who were high-performing students, to get them to learn about research, to give them an immersive experience into research. And I applied to the program and got in. And so for 2 months, I came to Emory University, to the School of Nursing, and learned about research. And I really became fascinated by it because I learned that as a researcher, an entire population can be your patient, and how research, while it takes a long time, research can really impact populations, communities as a whole, to try to make their lives better, to help them be a healthier community. And so that really inspired me, and that's when I realized that, I think I do want to become a researcher. Mentorship for me has been central to my success, I would say. And the program from Bridges to the Baccalaureate, I think, was really vital for me because I got to learn from researchers at the School of Nursing, to be able to have one-on-one contact with them and really learn about research. And they became accessible. It was Dr. Angela Amar who told me that I should apply to Emory to get my bachelor's. And so I listened to her, and I think that's been something very kind of key for me, is that I try to listen to my mentors as much as I can. And so when she told me to apply, I applied again, believing that she saw something in me that perhaps I don't see in myself. And while I was doing my undergrad, I was also told that I should apply to the PhD program. And I did that as well. And when I got into the PhD program, Linda McCauley, the dean of the School of Nursing, became my advisor. And I was very, very nervous about it because I had never thought that she could be my advisor. I think that the committee realized that she would be a perfect fit for me because she was doing research with farm workers. And when I went to meet with her the first time, I think she set the tone for me when she told me that she didn't expect me to have a research question, that we would find a research question for my dissertation together. And she has been an amazing mentor at the School of Nursing, as well as Dr. Vicki Hertzberg, who is the director of the Data Science Center, who's also guided me through my career and helped me with statistics. And, there's so many people at Emory that have really given me their time and have invested in me. The school as a whole has invested in me, and I really think that has played a big part in helping me, be successful in research and continue to push me forward to, gain better skills as a researcher, as a scientist. And I'm really thankful with Emory University for all the investment they've done with me and believing in me that I could do this work. So excess heat, I think, is something that has always been in my life, in everyone's life. But as a child, I had family members who worked outdoors in construction, and I noticed how they would always come home and they were hot, and they would talk about how they felt at work, some of the symptoms they had, it was really hot today and I had a headache or muscle cramps. And then when I came to the School of Nursing and I found out that Dean Linda McCauley would be my mentor, and she was working with farm workers and she was doing work with heat, I thought that it was just so appropriate and for me to help with that research because, the farm worker community is very much an immigrant community. Majority of them are immigrants from Latin America, similar to me. And we shared the same background as far as I had lived undocumented in the United States until I was 18 years old. And I thought that, we come from countries where it's very hot. But coming to the United States and actually working in the fields where they're going really, really fast, working really hard to pick the foods that we eat every day, and looking at heat as a hazard, which I think for a long time people have not done that, not even the federal government. Occupational Safety and Health Administration doesn't look at heat as a hazard. And so this was kind of transformative to start thinking about how climate change is affecting human health, how it's affecting outdoor workers, especially, workers who are very vulnerable. I felt that, this was an area that perhaps I could contribute to try to improve the working conditions of farm workers in the United States and try to find evidence-based solutions to protect workers from the heat. I think nurses are very well poised to help address the climate change crisis and help vulnerable communities at different levels. At the individual level, we are the biggest healthcare workforce. We are there with patients. Patients really trust us. So I think that there's lots of ways that nurses can educate patients and communities on how to protect themselves from environmental health hazards, whether it's heat or chemicals. That's one level. The other level I think that nurses are well poised to help with this is we need more nurses. We have the ability to influence policy. Nurses can become policymakers. Nurses can help write briefs There's so many ways that nurses can, sit on boards to where we can help allocate funds to certain communities that need it, who are suffering from the climate change crisis. Being leaders at their institutions, at hospitals that they may be working on, helping how to, change the ways that, hospitals, all of the plastic that they use. They can be champions as well, and hospitals, any setting that nurses are working at can really champion solutions for climate change and solutions that can help their patients and communities. For me, it's very important that being at Emory and being a Latina, that I work with other Latino organizations in Metro Atlanta and the state of Georgia. Because when I learned about Emory, I thought, Emory was a place, for other people, not for me. And I actually volunteered with the Latin American Association where they bring students to a college campus. And it so happened that in that year, I think it was 2013, Emory University was hosting Latino high school students to show them a campus, to kind of inspire them to go to college or university. And there was professors from Emory everywhere, and everybody was so nice. And I just remember standing in the middle of the quad thinking, how I wish I could come to a university like this, how I wish I could come to a school like this, because it was just magical standing there, and to think that I could, go to a university as prestigious as Emory was just mind-blowing to me. And I realized that, those type of events, connecting with the Latino community, is really important to provide hope. And I think that Emory it provided hope for me, and I think it can provide hope for other Latino high school students, to try to inspire them that they belong also at Emory, that they belong in schools, that they can, dream of being professionals and getting higher education. And so I've continued to try to build that relationship with the Latin American Association and the Latino Community Fund of Georgia, where we are trying to, build connections with communities where we can provide health screenings to the Latino community, so that, we can try to get the Latino community to see us as Emory as a whole as more accessible, that, we're interested in their health and in the Latino community, and just to, build those relationships.